Hello, everyone. I am Dr. Veronica Riera-Gilley, owner of Prairie Fire Pharmacy Consulting, and I am joined today by my colleague, Jana Bennett. She is owner of Medicine Shop Pharmacy, and we also have with us today Dr. Gundersheimer, and he has I Do Optical here in Sherman. And we are going to be discussing a little bit about glaucoma today because January is National Glaucoma Awareness Month, and we want to bring more information to our patients on taking good care of their eyes. So thank you, Dr. Gundersheimer, for joining us today.
Sure. Thank you for having me.
Can you tell us a little bit about your practice and about yourself?
Yes. Well, I grew up in Miami and came to Texas in 1979. Lived in the Houston area for a while, and that's where I went to optometry school at the University of Houston, College of Optometry. And then moved up to the Dallas area in 85 when I graduated. I was always a Dallas Cowboys fan when I was growing up in Miami, so I was kind of glad to be out here in this neck of the woods and support my team. So been in Sherman since 86. Had this particular office that we're in right now since 2010. I Do Optical is a full service optical. We have frames for any kind of budget, and we handle all types of primary care optometry and work very closely with the ophthalmologists in town. If we see a problem with a patient that we need to refer for, say, cataract surgery or a retinal problem or something like that, we refer to them. We also co-manage glaucoma patients with them. So it's a very symbiotic relationship that we've enjoyed here. We have great ophthalmologists in this area. We're blessed to have them.
Okay. Can you share with us what is the difference between an optometrist and an ophthalmologist?
Sure. Well, basically, an optometrist is in charge of primary care, vision care. In other words, we do exams for eyeglasses and contact lenses. We can remove foreign bodies from the cornea. We can treat red eyes. We are able to treat glaucoma. We usually co-manage those cases a lot of times with an ophthalmologist who is an eye surgeon. An ophthalmologist went to medical school. We went to optometry school. The curriculum is a little different. So they are the folks who do the eye surgery. And they do things like LASIK. They do cataract surgery, the more invasive glaucoma procedures, anything that has to do with medical conditions of the eyes, they treat. Usually if it's primary care, like an eye exam or contact lens stuff like that, they usually like to refer to us, and we handle that type of thing. And if we see anything that looks like we need to pass on to them for further evaluation or any type of surgery, then that's what we do.
Okay, thank you.
Mm-hmm.
And so can you tell us what is glaucoma?
Well, glaucoma is when the fluid in the front chamber of the eye, which we call aqueous humor, it's kind of a watery fluid that's continuously filtered out of the bloodstream, and it's pumped into the front chamber of the eye, and it drains out in this little corner in the front of the eye. It's kind of like the guttering around your house. If that fluid pressure gets too great for the eye, and that can happen one of two ways. Either too much fluid is produced, or it can't drain out properly through that little drainage ditch. So you get a backup of fluid pressure in the eye. And since the eye is a closed system, that pressure translates all around the eye, and it starts to press on nerve fibers coming into the eye from the optic nerve in the back of the eye. And so glaucoma is when the fluid pressure in the eye is too great, and it starts to kill off these nerve fibers very slowly. It's such a slow and gradual process that most patients are completely unaware it's happening, and you cannot feel that pressure in your eye until it spikes very high, which in most cases it doesn't. So in most of these cases, this is a disease where the patient's completely unaware it's going on, and the only way that they know it is if they have their eyes examined. So along those lines, one of the things that makes me cringe is when I see somebody who comes into the clinic in their mid-40s, the first thing that they're having problems with is having trouble with their close-up vision, which happens to most people after the age of 40. And they've never had their eyes examined. because they feel like they can see well off at a distance. And so I can't tell you how many times we picked up glaucoma in these patients that we could have picked up much earlier on. You know, I even like to tell the story, unfortunately, about a trucker who came in his mid-40s, and we had to tell him he had to stop his livelihood because he had lost half his visual field from glaucoma. He didn't even know it. So
Wow.
he wasn't safe to drive a truck anymore. This is a disease that we're able to pick this up at very early stages now. We have the type of equipment that gives us data that we've never been able to have before on the very early progression of glaucoma, and we can detect it early, and in most cases that really retards the progression because we can get these patients in on treatment at a much earlier stage, and we can preserve their vision. But what it does, if it's left untreated, is you start to lose part of your visual field, and usually the field that you lose first is where these two visual fields overlap in the center, so you don't even know what's going on because one compensates for the other. And then so if we let that go over the span of years, then your vision starts collapsing in, and we get what we call tunnel vision, where you only see just in little spots, right in front of you. You don't have any peripheral vision left. And then if that's left untreated, you can go completely blind.
Yeah,
So it's an insidious disease. Yeah.
Yeah, I was reading the statistics on it, and I wasn't aware that it's one of the leading causes of blindness, and that was new information to me.
Yeah, but it's so detectable, and I preach this I go to the Chamber of Commerce stuff, and and I say to folks, if you've never had your eyes examined, you never know if you have glaucoma. You just don't. So go get your eyes examined, if for nothing else, to make sure you don't have glaucoma.
That's great advice.
Mm-hmm.
I'm glad you're saying that because I've been encouraging my own husband to go, and he hasn't gone because he sees fine. So I'm glad.
That's one of the reasons for this month that's coming up, because people just aren't aware of this.
Yeah, thank you for sharing that great information. I'm excited to share this just with my own family and especially our patients. So tell us about the treatments for glaucoma.
Well, initially, and first of all, there are several types of glaucoma. There's not just one variety of glaucoma. So it just what the problem is. If there's too much fluid that's produced into the front chamber of the eye, that's one kind of glaucoma. If it can't drain out properly around that little drainage ditch, that's another type of glaucoma. So most of the types that we see are either going to be open angle glaucoma, where that drainage ditch is wide open and it's just not filtering out properly, or too much fluid is being produced. And then there's also narrow angle glaucoma. And narrow angle glaucoma is a real tricky thing. That's when that little drainage ditch, that little angle in the front of your eye is real narrow. We can see if it's narrow usually by taking a look at one of our devices. If not, there's a specialized contact lens we can put on the eye and examine that angle better. But a narrow angle glaucoma, and this is very important for where Jana comes in, because narrow angle glaucoma can happen very rapidly. That little drainage ditch can zipper shut like a Ziploc bag in a matter of minutes, and then you get a real rapid rise of fluid pressure in the eye, and that's one of the few true eye emergencies that we have, because it has to be reversed very quickly, or you can lose vision permanently in a hurry. So the symptoms of a narrow angle glaucoma attack it's like you're looking through a dense fog all of a sudden. You feel kind of queasy or sick to your stomach. And that usually happens in one eye versus both eyes. So if it happens in one eye, our viewers out there will know kind of what to do. But if all of a sudden it looks like you're looking through a dense fog, that needs to be looked at right away, because that has to be reversed as soon as possible. But Jan, as I was going to say, in a lot of our medications, especially even over-the-counter medications, and one of the big ones is antihistamines that we buy over the counter. And the contraindication sections there, it'll say, do not take if you're prone to glaucoma. That's what we're talking about. If you have a narrow angle, you can close that angle off from a slight pupil dilation that you might get from even taking an over-the-counter antihistamine. So if you look at your medications and it says be careful. Do not take if you're prone to glaucoma. As long as that angle is open, you're okay. But that's what they're talking about usually when they say, it's contraindicated in those who are prone to glaucoma.
So it's good for patients to ask then what type of glaucoma they have so that they can inform their pharmacist and we can make a better recommendation for them as to whether or not
Yeah.
they should avoid that.
Yeah, your eye doctor should be able to tell you that right away if the angle is open or if it's narrow. And what else is interesting is as we age, that angle narrows anyway in most people, because the lens inside of our eye will swell and it'll push the iris, the colored part of our eye, forward and close that angle off a little bit more. So sometimes when patients have cataract surgery and they get a lens implant put in there, it actually allows that iris to back off that angle, and it eliminates their issue. So that's an interesting thing for the anatomy of the eye.
Okay. And what do you wish that your patients knew about glaucoma?
Well, we've covered some of that already, and that it's a problem that they cannot know in most cases is going on. You cannot feel that pressure in the front of your eye. Now, even people with a quote unquote a normal fluid pressure can develop a glaucoma, and that's what we call a low pressure glaucoma. That's another type of glaucoma, which is a little more difficult to treat, because usually the first line of defense in glaucoma treatment is to prescribe some drops for a patient, which either decrease the amount of fluid that's produced or they help to increase the outflow in that drainage ditch. And so glaucoma medications is usually, once you're on glaucoma medications, you're on glaucoma medication. It's not something you can stop usually, unless, let's say, for instance, they were able to improve things via other surgical methods or, et cetera. But that's the first line of defense. And there are surgeries that can be done either with a laser. They have new stents that they actually insert into that canal right now that help the outflow tremendously. And oftentimes they'll do that in someone who's got borderline glaucoma and they're having cataract surgery. The surgeon will go ahead and suggest implanting one of these little stents, and that really can decrease the fluid pressure in the eye. So there are specialists that treat glaucoma too. If there's an instance where either myself or an ophthalmologist can't control it themselves, they will refer to a glaucoma specialist. Oftentimes, at that stage, the prognosis is not as good. And here's an interesting thing that I don't know if patients knew, but the reason that Bono from U2 wears sunglasses all the time is because he has glaucoma, and the light actually hurts his eyes, so that's why he wears sunglasses all the time. So there are, glaucoma affects a lot of people, and as I mentioned to you before we started taping today, one of the things, unfortunately, that we're finding out with COVID-19 is that there are reports in the literature of people who have recovered from COVID-19, but weeks to months later start to develop glaucoma as a result of having the disease. So this is just one more reason why people need to be as careful as possible, and protect themselves and others from getting this terrible virus that we're having to deal with right now. Because there are reports that in some cases it's leading to glaucoma. And the reason for that is it's an inflammatory disease. And it can inflame these mechanisms that we were talking about that produce the fluid and help with the outflow. So it's kind of scary.
Yeah.
Now there are also risk factors that patients have for glaucoma. Certainly a family history is a big risk factor because it does tend to have a hereditary component. There are race factors as well. We find that African Americans tend to have a higher incidence, as well as Asians. Those are all risk factors. So if you have a family history of glaucoma, all the more reason for getting that looked at and making sure that everything's fine for you. And we also find that diabetics tend to have an increased risk of glaucoma as well.
When should people start going I guess we were talking earlier before we were taping, and how, a lot of times people don't go to the eye doctor until they have trouble with their vision, kind of like you said earlier. So when should people, you're not having any trouble seeing per se, when should people start going to the eye doctor? And is this like an annual checkup that we should be doing every year to keep an eye on this?
Well, those are good questions, really good questions, because what we recommend here is that if you have a school-age child, usually 4, 5, 6 on up, we should at least try to take a look and make sure everything's healthy in the eye, if they haven't had a problem up to that point. Now, when we start routinely checking children around age 11 or 12 with our little air puff test, which actually measures the fluid pressure in the eye. But what we do with the children who are younger than that is we'll take a look at their optic nerves as a part of our routine exam and just make sure the optic nerve looks healthy. And as long as it's looking healthy, I usually don't check the actual pressure. Some doctors do at an earlier age, but I usually wait till they're, because a lot of times they don't like that air puff, and even adults sometimes don't even like that air puff, but our machine is pretty easy to tolerate. So usually when they're around 10, 11, 12, and again, if I see anything that looks unusual with their optic nerve, we'll try to get a fluid pressure on them at a much earlier age. And then we use another device called an OCT, which stands for Ocular Coherence Tonometer, or tomograph, excuse me. And what that does is there's a scanning laser that scans the nerve fiber layer in the back of the eye, and we look for areas that might be thinning. And that's a non-invasive test. It's a very simple thing. It's no more invasive than a video game. And so if we see anybody that's suspect, we schedule them back for an OCT. That's our first test. And if that looks unusual at all, we'll schedule them in for what's called a visual fields test, where we actually measure how well they see all the way around them in each eye. And we'll look for any defects there. But that OCT is that piece of equipment I was talking about that picks things up at a much, much earlier stage than we've ever been able to with glaucoma. But that's usually how we approach it here in my office. And again, it varies from office to office as to what age they start doing the actual air puff test. Does that help?
Yes.
Oh, and you were asking about, is this an annual thing? If we see that there's an issue there, I'll want to check it annually for at least a couple years. As long as that's stable, then we can push that out a little bit longer. We recommend annual eye exams especially for people who are 50 or older. Certainly if they're younger individuals, school-age kids whose vision is changing, because the vision changes usually up into late teens, early 20s for the vast majority of people. But if someone's in the age range of about 21 to 30, or even 21 to 40 or so, as long as they're not having any issues, we can probably push that out to 2 years at least, for routine eye exam.
Okay.
We'll usually recommend at the end of the eye exam when we see the patient back. So, and if they're contact lens wearers, we like to see our contact lens patients every year just to make sure everything's okay.
If people come and schedule with you during this time where we're concerned about sharing COVID, what precautions do they need to be prepared to take when they come and see you in the office?
We have a whole list of protocol. We have a little mini questionnaire we ask them about, have you been around someone with COVID? Have you been exposed to COVID in the last couple of weeks? And as long as, all those questions are answered satisfactorily, we ask that they do wear a face mask in. If not, we can provide them with one. We have hand sanitizer here. We do a temperature check at the door. We only have one patient in here at a time, and all of our staff is masked. I wear a face shield, a plastic face shield as well, and gloves. And so we clean all our equipment between patients. So everything's wiped down, sterilized. If they tried on glasses, those glasses go into a UV cabinet and they're all sterilized before another patient tries them on. So, we're trying to be as careful as we can. We resisted opening as long as we could because we were waiting to see if the cases were coming down. They weren't trending downward at all. So we had closed on March 20th and we reopened at the end of August. And so we've been back up and running since the end of August. And knock on wood, everything's been going pretty smoothly. I've only had 2 patients that have refused to wear a face mask, and we give them the option of us rescheduling for a time down the road when we don't need the face masks, or they're free to go elsewhere. And most patients are very cooperative about this, and we need to be. So, to help.
Mm-hmm. That's good information.
Yeah, well, everybody should be taking these precautions. It's a very simple thing to do, especially wearing face masks during this time. I think people who are not wanting to do that are finding out on a daily basis that they either know somebody or they have someone in their family who's touched by this disease. And you read account from person to so many individuals that did not want to wear those face masks. And now they're saying, where are the face masks? You do not want to get this. So we've got to do that until we get these vaccines, which hopefully will be coming out pretty soon, to everybody.
It's been interesting, the discussions in the geriatric space. I'm a board certified geriatric pharmacist, and some of the pushback we've been receiving is, well, we didn't do this for the flu. Why would we do this for this? And some of the talk is maybe we should have been doing this during the flu and in our elder care spaces for the health.
I'll tell you, ever since I've been wearing a mask, I have not been sick, not even had a head cold. So this practice may linger for me for a while. It's been very nice. Jana, what have you noticed in the pharmacy business with this?
Yeah, same thing. Our lobby was closed for a while, and we finally decided to open back up once people were used to wearing masks because we felt so much safer. And yeah, our staff has not been sick. It's been really eye-opening. And the patients, we were worried about pushback from patients, but we rarely have anybody that comes in without a mask. And when they do, we just hand them one, they put it on, and it's gone much better than expected.
Yeah, I mean, no one likes to be sick, even with a darn head cold. So it's interesting what we're finding out with these by wearing these masks. And of course, there's certain cultures around the globe that just do it routinely anyway.
Yes.
But I think it's also can be kind of fun because you kind of see how people express themselves on their face mask. It's kind of neat.
That is true. It's been fun to see people's personalities in their mask. And I'm really impressed at people who are good with the facial recognition from here up. Somebody saw me in Home Depot, someone I hadn't seen in 2 years, and they were like, "Hey!" And I was really impressed because it took me a minute. Like, I couldn't place them. So I think that's interesting to see people's I guess visual memory and acuity with just half a face.
And if they can't recognize the face, they can always come see me and we can get them fixed up. And
exactly. Very good. Well, is there anything else that we think is important to discuss before we wrap up today?
The only other thing I can think of is if you're placed on glaucoma medications, it's one of the problems that we have with treating this is there's a lot of non-compliance out there with patients who will skip a dose or two or just forget to do it one day or just take their drops on occasion instead of regularly, and that's just not a good way to manage glaucoma. You're going to get progression of your disease if you're not faithful about putting your drops in when they're prescribed. So if you're on glaucoma medications or if you're put on glaucoma medications, try to maintain strict adherence to the dosage regimen that your doctor prescribes for you. It's real important.
Are there any apps or dosing reminders that your patients have reported to you that they use to help them remember to get their drops in on time?
Oh, I'm not aware of any. I'm sure there's some out there. I would imagine that that's a good question. But to be honest with you, I don't know if there are any apps out there.
I've heard of some, or there's different timers where it makes you scan, like use your cell phone, like as a way to confirm, like instead of just being able to go, oh yeah, I'll remember to go to my bathroom and put my drops in.
Well, that'd be good for me because I forget that stuff all the time too. So
it makes you use the scanner on your phone to scan the barcode on your prescription, and that's what turns the alarm off.
Oh, that's
I
neat.
don't know the name of that app, but I've heard of different reminder apps or timer apps that patients are using, and so I was interested to know if any had come up for you.
Yeah, that's cool.
Now I'll have to do some homework and get back
That's
to the name of that app.
Yeah, yeah.
Okay. Well, thank you so much for your time today. I've learned a lot. You certainly gave me some information that I didn't know before about glaucoma, and I'm very excited to share this with my family and all of our patients.
Yeah, so the main takeaway from this is don't wait 5, 6, 10 years to get your eyes examined. Make sure they're healthy. Even if you can see well, at least you have good peace of mind.
Yes, and go see you at I Do Optical.
Well, of course.
Yes.
No, we have a host of outstanding optometrists and ophthalmologists in this area. I'm glad to be a part of all my colleagues in this area. Everybody gives great care. We're always glad to see new patients, but there are plenty of great people to see in this area. So, don't delay. Get your eyes examined.
Sounds good.
Great.
Well, thank you so much.
Thank you.
We
And Janice, nice to meet you.
You too. Thank you.
All right. Bye, ladies.